Thanks, Erin. Great to be here this morning. Yeah, so the Gore Viafort Venous Stent, a dedicated high radial resistive force venous stent designed specifically for iliocaval pathology and with an indication, trial designed to achieve an indication for IVC treatment. As you can see, a EPTFE technology with a sinusoidal wound nitinol frame available in lengths in diameters between 10 and 28 millimeters and in lengths 50 to 150 millimeters in diameter. As I mentioned, it has a fluoropolymer lattice designed for conformability and high radial resistance, and it has radiopaque markers, as you might expect. A delivery system between 10 and 14 French. Catheter working length is 120 centimetres. Now, there have been two separate studies, as I mentioned, a unique indication for use in the inferior vena cava, being sought under a breakthrough designation from the FDA, prospective multi-centre non-randomised trials. The IVC study I'll show you a case of evaluating the Viafort for inferior vena caval obstruction with or without concomitant iliofemoral obstruction, and that enrolment has been just completed. We don't have data as yet, of course, and in the iliofemoral study, evaluating patients for the treatment of symptomatic iliofemoral venous obstruction, recruitment is well underway in the US. This actually is a case of ours and actually the very first global case with the Viafort device, a 51-year-old male. In 2008, had a submassive PE and DVT, had an IVC filter inserted, unfortunately was lost to follow-up, and the filter was never removed. Presented in 2019 with caval and iliac vein thrombosis that was partially treated with thrombectomy and thrombolysis. With that, there was subsequent resolution of the thrombus, but had a caval stenosis, and as you can see, also associated with significant caval strut penetration. So when we got to see him, he had had post-thrombotic symptoms since 2019, significant right leg swelling and definite venous claudication. That was a very limiting factor. He had a VCSS score of 2 and CAP of C3 due to his edema. You can see on venography the penetration of the IVC filter through the wall of the IVC. Now, the procedure, obviously, with the very first global case, there were a lot of people in the room, and we obviously had to retrieve the caval filter that had become incorporated into the wall of the IVC. That turned out to be pretty tricky, and we ended up needing some forceps as well as a snare, and eventually we got that out, which came to planning for the Viafort case. The stent was designed to the IVC immediately distal to the stenosis. There was some dilatation above the stenosis, but we sized it to that distal segment. A 24 millimetre device, 75 millimetres long, was chosen. Pre-dilated the stenosis with a high pressure balloon, the Atlas balloon, and we chose the, as mentioned, the 24 millimetre device that will manage a range of diameters between 18 and 22 millimetres. This was the first deployment. It was very easy to deploy in a very accurate way and deployed very nicely, was post-dilated with an excellent result. You could see there was a very round cross-sectional response to treatment through the stent due to its high radial resistive force. The patient clinically really experienced an immediate improvement in symptoms. And we were able to follow this patient now at 24 months, and they've had a persistent improvement in their clinical symptomatology. You can see at 6 months, this IVC is now widely patent maintained by the Viafort stent, and at 12 months, a duplex ultrasound shows a very satisfactory appearance. So the Viafort from Gore is the only venous stent specifically designed for iliac veins in the inferior vena cava. It has this high radial resistive force with excellent conformability. The caval study has now completed enrolment, and the iliofemoral study is still enrolling we really look forward to seeing those results. Thanks for your attention.